Lumbar transforaminal epidural, this is the commonest procedure in a pain clinic. So how we do it? First, simply position of this procedure is a prone position. Patient will lie prone, and then we understand what are the parts of the C-arm. So C-arm, this receiver will be above, and under the bed it is the emitter. So of course, when we will see the picture, it is a AP image. And then the needle which we are using, so this we can carve, we can make the tip carved. Otherwise we can use straight needle also, that is not a very big issue. And now this is a pillow, you can put a pillow under the abdomen, but that is also not 100% required every time. 5 steps. First thing is side determination, right side or left side. So whenever the picture, we are taking the picture, so we should see that patient's right side, and the on screen also it should be on the right side. Sometimes if you do in the opposite side, that is also, I mean, not against the norms, but we always make it right side to right side so that we can understand, we do not do a mistake. So level identification, second time, the counting should be the very important thing, because lumbarization, sacralization, everything is possible. So you have to count the level. Third step is true AP view. So what is true AP view? Pedicle to spinous process distance should be equal and end plate parallel. And fourth step is oblique view. So what is our aim actually? Our aim is to make a Scottie Dog view. So here you just see right side to right side, level identification. So say this is L4. We all know that iliac crest level is between L4 and L5. So this is what always remains constant. Other leveling thing like from T12 or from lower side, if you start counting, there can be mistake due to this lumbarization, sacralization, mainly due to iliac crest at L4-5, that counting remains all right, always. Now you see that it is not a true AP view, because the end plate here, it is a oval shaped end plate. And this side also spinous process and pedicle distance are not equal. At the same area, I have made it equal, spinous process and pedicle distance equal, and the end plate has become one line. So after then fifth step was the oblique view. So after making it oblique, I can see that this Scottie Dog image everywhere at every level. But then I will be focused on that level where I am interested. So at this point I am interested now. After seeing the Scottie Dog, I can put the needle in 2 ways. One is safe triangle of approach and one is Kambin's triangle approach. So this blue line actually represents a as if the nerve root is going in this way. So it is not only going laterally, it is also going from posterior to anterior side. Okay, anteriorly and laterally it is the direction. So I will put needle either in the red part or in the blue part. So in red part it will be a safe triangle approach or subpedicular approach, and in blue part if I put the needle, that is called Kambin's triangle approach. Both has their positive point and negative point. So this is called tunnel view. So always this approach is, this procedure is a tunnel view approach. So this is non-tunnel view and this is tunnel view. So in while doing the procedure, while you are proceeding, then if your needle is going like this, then you think that you are going out of the foramen. So it should be a tunnel view like this, left side picture. Okay. Then final needle position in Kambin's triangle approach means, Kambin's triangle means the lower half of the this whole foramen in the lateral view, lower part. So this is I am progressing, and at this point it is the final needle position. So final needle position is actually important. How you are entering there, either you are going a bit laterally, starting a bit laterally or medially, that doesn't matter. Mainly it matters the tip of the needle should be, the final needle position should be correct. So it is the lateral view final and it is the AP view final. Okay, so this is the Kambin's triangle approach. Why I can understand in this lateral view in the lower part of the foramen. Okay, So here it is the subpedicular approach, same thing, just under the pedicle. So pedicle starts from this side to this side, I mean like whole under the pedicle, it is the foramen area. Again it is the tunnel view approach, right side picture, it is the tunnel view approach. So here again it is the final needle position, but it is in the upper part of the foramen. So it is the subpedicular approach. Subpedicular approach in lateral view, in epi view. This is the final needle position. Here in the so comparison of needle position, here in most left side picture is a Kambin's triangle approach in lateral view, and this one is second one picture is the lateral view but in subpedicular approach. Like here in epi view, the third picture from left side, it is the subpedicular approach in epi view, and fourth picture it is of course in the oblique view, but it is in the lower part, Kambin's triangle approach. So here after giving contrast, it looks like this. So your drug always should go in the epidural side, epidural space, and then in lateral view also you can check that whether it is going in the correct area or not. Your contrast should go in the anterior epidural space. Not if you see sometimes in some patient that it is spreading in the posterior epidural space, then patient may not get relief because problem is in the anterior epidural space. So this is the contrast application correct, and so this is lateral view and this is the epi view. Okay. Incorrect contrast application, this left side one is vascular spread, and this right side one is also vascular. Left side is a DSA picture, this is simply an X-ray picture. So we will see by C-arm, in the right side one picture we will see by C-arm. Distal spread incorrect, this is like we are not doing any complication here, but we are not getting a typical picture also. So in that case also we have to reposition the needle, otherwise patient will not get relief. Atypical spread, so these are not doing any complication, but this is not going to give me the result because it is not going in the epidural space, contrast is not going in the epidural space. So some more consideration, consent should be taken, initial pain should be, VAS should be more than 4, like moderate pain should be there, otherwise you should not go for intervention. Needle size, okay, we will finish within 30 seconds. So needle size, it should be smaller, otherwise procedural pain will be too much. Contrast, you can dilute or non-diluted, post-procedure advices you should give. Okay, thank you.